Welcome to the East Bay Elder Care Channel, brought to you by Horizon Elder Law and Estate Planning. Today, our host Stephanie McNaughton speaks with the caring professionals from Advisors on Aging.
Hi, welcome to the Contra Costa County and Tri-Valley Elder Care Channel. My name is Stephanie. I'm the Marketing Director for Horizon Elder Law, as well as today's host for the Contra Costa County and Tri-Valley Elder Care Channel. Today we're here talking with Sherry Hartman, Lauren Eppinger, and Carolyn Lauder with Advisors on Aging to learn more about Advisors on Aging as a company, as well as the services that they offer, such as geriatric care management. Ladies, can you tell us a little bit more about yourselves individually and your background, how you got involved with working with seniors?
Sure, I'll start. So I'm Lauren Eppinger. I'm a licensed clinical social worker. And after I got my master's in social work in graduate school, I came back to the Bay Area and got a job at an adult day healthcare center for individuals with dementia. And I kind of pursued this route as my grandmother had Alzheimer's disease, so I had a real kind of personal investment in learning more about the disease and getting experience. After serving as the social worker, I went on to become the program director and really just fell in love with the population and continued to work with older adults in various community programs to prevent premature institutionalization of older adults. I've also worked in a variety of hospitals helping with discharge planning and doing medical social work.
And my name is Carolyn Lauder, and I discovered my passion for working with older adults back in 1991 as a volunteer for the Center for Elderly Suicide Prevention in San Francisco. I decided to go back and get my master's in social welfare from Cal Berkeley with an emphasis in gerontology. And from there, worked for a variety of agencies over the last 23 years, including the one that Lauren worked for, Alzheimer's Services at the East Bay. I served as a program director and social worker there for 10 years. And from then on, went to do some private geriatric care management, as well as working for other agencies serving the older adult population.
Wonderful, thanks.
My name is Sherry Hartman, and like Lauren and Carolyn, I'm a licensed clinical social worker. I've been in the field for almost 25 years. I started in San Francisco with the Institute on Aging and evolved into working in the East Bay. I've done private geriatric care management as well as work with Jewish Family and Children's Services of the East Bay. I am also a therapist, and my favorite population to work with is those diagnosed with younger onset Alzheimer's. I've also worked with couples and with families coping with all stages of the disease. And geriatric population is my favorite group to work with.
Wonderful.
Yeah, so the three of us came together to really fulfill our passion for working with older adults and to create geriatric social work services through Advisors on Aging. Advisors on Aging is unique in that we're a licensed clinical social worker professional corporation. So what that means is that any employee in our agency does need to be licensed in the state of California. Carolyn will talk a little bit about the services we provide.
So we provide a wide array of services for older adults. And primarily we provide counseling, consultation, and practical support for people dealing with all the challenges that come with aging. We work with older adults who might have dementia, memory loss, chronic illness, physical disabilities, as well as depression. We really help guide families in understanding what the different care options are for their older adult. And then we make referrals to community-based organizations to help meet the needs of the individual.
In addition to that, we also provide some community services. So I lead a support group for caregivers, so spouses, adult children dealing with an aging parent, and then now starting a group actually for older adults who are residing at an assisted living facility. Carolyn leads a group for the younger onset population with the Alzheimer's Association, and Sherry leads a group for long distance caregivers.
That's great. One of the things that I love about your organization is that this is all you do. You live and breathe geriatric care management, and you don't try to mix and do in-home care, serve everything else. You really specialize in this, and I think that's such a wonderful thing. It's unique. Most companies try and do both. whereas you're able to just really be independent in how you care for your seniors.
Right, and that's why we started Advisors on Aging, because we wanted to really tailor our services directly to the people that we're serving.
Yeah.
So if the person's goals and desires are to remain at home, then we're going to work with that family to make that happen. Sometimes people would prefer to live in a different home, a different environment, assisted living, or maybe they need skilled nursing care. We're able to help them navigate that process and find the best facility possible for them. So we're really looking at the needs of the individual.
That's amazing. What is the difference between a geriatric care manager, social worker, versus an in-home caregiver? Because so many people don't really understand the difference.
Right.
The primary difference is that we are licensed clinical social workers. We have collectively 50 years of experience in the field, and we see the complete picture. We see what we call the biopsychosocial picture that's involved with the senior in their environment. So we look at the individual, we look at their medical issues, we look at their home environment, we look at their socialization. In-home care providers oftentimes focus on task-oriented to keeping the senior in the home, but we see the broader picture. And we help the families understand options available so they can make decisions about care for their loved one.
Okay.
And, you know, families need education about what home care is. And people do get confused with all the terms being thrown around in elder care: caregiver, case manager, social worker, care manager. But really, we help the family understand how to use the services. If you're going to have a home care provider, how many hours do you need? How do you set up the care? Do you hire privately? Do you use an agency? What can you expect from a caregiver? So we do a lot of that, and we coach the families, we coach the caregivers on how to work with that individual in the best way possible.
Well, that's great. So give me an example of what a client would experience when they hire you. How often do you come in and visit? What do those visits look like? Can you just explain a little bit more about that?
Sure. I'll start just by kind of sharing our initial process. And typically what we do is we'll talk to the client or a family member on the phone and get a brief understanding of the situation. And then we go out to the home or the care setting, wherever the person is, to really be able to see them in the environment. And during this assessment process, we're really looking at the continuum of someone's independence and safety, and what are all the risk factors in between. So as Sherry mentioned, conducting a biopsychosocial assessment that assesses sort of their immediate needs, the risk factors, and also what to expect long term. Also looking at the person's quality of life, what their wishes are, and how a family can work together to provide someone with the best quality of life. So after that meeting, we write up a care plan that the family can have that really provides interventions for those immediate needs as well as long term. And then once the care plan is completed, we'll meet together to really figure out the implementation phase, and that's where we determine how often we'll be visiting. So for some families, we just write the care plan, and that's kind of all they need to be guided in the right direction. And for other clients, we see them every week. We attend doctor's appointments. We're working with the caregivers in the home. We're working with the staff in an assisted living facility or skilled nursing facility to be someone's advocate. So it's pretty varied based on what the individual's needs are.
Yeah, we can be involved as little or as much as a family or an individual needs. Sometimes people call us just for a consultation on the phone. They just want to make sure they're on the right track with mom or dad's care, and they just need that professional support to say, you're doing a great job, consider these few other things, and call us back if you need us. And as other times, as Lauren said, we're seeing a client weekly because maybe the adult child lives out of town and they don't know what's going on with mom and dad. That's a really typical call for us is, you know, I talked to mom the other day. She didn't seem quite right. I can't get out to California for a few months. Could you go out there and see what's going on? And that's what we do. We deal a lot with people that call us and say, you know, I think mom or dad need help, but they're never going to accept it. They don't even listen to me. And we have a way, because we're professionals and we don't have the family baggage behind us, right, that comes along with that, that we can go, you know, we can find a way to get in and work with that person in a non-threatening way to help introduce some ideas about how they might get support. And that's, I think, where our social work background comes in, because we know how to do it. You know, we know how to get in there, and it's again a lot easier if you're not an adult child.
Yeah,
sometimes.
no,
Yeah.
that's great.
Or it could be, you know, a crisis and someone calls and said, you know, they've just been hospitalized and the hospital's saying they can't go back home. What
That
do we
comes up
do?
a lot,
And so what we can really do is figure out, okay, what happened before the hospitalization? Was it medications being missed? Was it falls happening in the home? And try and assess that need and then really figure out what is the right level of care after being hospitalized.
And I would say, Stephanie, that we really have a lot of expertise in Alzheimer's and other dementia. So a lot of what we're doing is educating families, helping them understand what they're looking at.
Mm-hmm.
You know, people will call and say, I don't know if this is memory loss. I don't know if this is normal. What's going on here? And we've worked with pretty much every type of dementia and every stage, and we really understand the challenges that come up for both that individual dealing with it as well as the family members. So we do a lot of counseling. Sherry actually counsels people with.
I see individuals who are diagnosed with younger onset. I work with couples struggling with a diagnosis. I work with families. We facilitate family meetings to help families get on the same page with one another as they're deciding their care plan. Our services are varied, and with every situation it might be a little bit different, but because we have the social work experience and training and license, we can handle pretty much anything that comes our way.
Great. So I guess you guys have all a little bit touched on the next question that I have, but more to just really hone it in. Let's say I'm dealing with my elderly mother and she's dealing with some issues. How do I know when it's an appropriate time to contact you?
The earlier the better.
Okay.
Okay. And unfortunately, sometimes we get calls when a crisis has happened, as Lauren said, or someone's in a facility that's not the right fit, and the person's already had to go through that transition and it's not going well. So we want to hear from people, you know, as early as possible, because if things are going well, great. You know, we're out there to assess not only what's going wrong, but what's going really well and how we can just put little supports in there to keep things running as smoothly as possible for that person and to help them meet their goals in aging. So as soon as you have any little red flag, you know, like, gosh, you went over there and mom doesn't seem to be taking her medications right, you know, she said she took them, but the bottles are kind of outdated and, what might be going on? Or mom's forgotten the last appointment that I was meeting, right? Or something as small as, you know, mom seems a little isolated. She's not getting out as much. You know, maybe she just needs help planning and executing those plans. So the earlier the better. That's the sum for that question.
Although we have lots of experience in helping families manage crisis, and that's often when they call, it is best to call early and get that care plan in place so that when there is an emergency, if there's an emergency, the family's prepared.
Absolutely.
That's one of the things that makes adult children feel better about the care for their parents, is knowing they have a plan in place before something happens.
Right.
Absolutely. Well, then you generally do prevent some of those crisis situations
Exactly.
as well. Yeah. You
Exactly.
don't even have to go through
Right.
that.
But families need support, you know. They need support dealing with parents that are going through all different kinds of challenges. And caregivers can become so overwhelmed and so burdened. And if we can relieve some of that stress for them, you know, some families choose to just have us do things for them because they're working full time. They've got children at home. They just can't get it together to provide that daily check-in or whatever that person may need.
Right.
And we're not overtaking their role, but we're supporting them so they can be that adult child again and visit with their parent in a way that it's not always feeling that they're telling them what to do and that kind of thing.
So I'm sure people are wondering, there's a consultation. Is there a fee for that? And are there any resources to help pay for that? Does long-term care insurance cover your services?
Our services are for fee-based, and we charge by the hour. And we estimate that an initial case is anywhere between maybe 2 and 5 hours. We also do charge for travel time, which is pretty standard. We charge half of our hourly rate for travel time. Oftentimes, long-term care insurance will cover the cost of our services, but the individual family and the individual older adult needs to check with their policy to see if we're covered. And unfortunately, Medicare doesn't cover our services at this time. We wish they would, but they don't.
And we do provide, if someone wants to call us and just talk their situation, we definitely will do that, have a free consultation with them. Sometimes people just want to meet us in person, and that's fine too if they live locally. It's a really personal subject, right?
Absolutely.
And so they need to feel that they trust us. It's a trusting personal relationship. So we're more than happy to do that.
Wonderful.
And we serve Alameda and Contra Costa County, and we tailor our individual services to the needs of the individual client.
Wonderful. And one thing I also wanted to ask, do you know if the Veterans Aid and Attendance would pay for any of your services as well?
I don't think they do at this time,
They
which
don't?
is some of the supplemental services for in-home care.
Right. And as Sherry said, to when we first meet someone, if they're asking for recommendations, that's usually, like you said, up to about 5 hours. And sometimes, again, people use us for that hour consult, then we don't hear from them for a year, and then we spend a few hours, but we're very willing to work within that person's financial means.
Wonderful. Well, do you have anything else you'd like to add or share?
Well, thank you for inviting us.
Yes,
This is so fun.
This is a pleasure.
Oh, yeah, no, it was wonderful having you because what you offer is so unique, and there's not a lot of groups that do what you guys do. And I know you outside of today, and you're very compassionate, loving, and passionate about what you're doing.
We love what we do. We're
Yeah.
so happy to be doing this together.
Well, thank you so much for joining us and for sharing more about Advisors on Aging. If you would like to get more information for yourself or a loved one, you can find all their contact information on the Elder Care channel, including a link to their website, as well as their phone number, or you can contact these lovely ladies directly at area code 510-693-0284. Thank you for watching. We hope you have a wonderful day.